So the day I was born, they did a chest x-ray and went, that's not supposed to be there. Neuroblastoma, which is some nerve, and it was wrapped around my spinal cord. We went from Women's Hospital in Baton Rouge, where I was born, to Lady of the Lake. They had a woman there, Dr. Sheila Moore, who was like, I think it's neuroblastoma, but this is not my expertise. We're going to send you to St. Jude. So it would be chemo one day, fly back home, stay at Lady of the Lake for 6 days. The 7th day, fly back to St. Jude, do chemo, and then did that off and on. First it was 1 week, and then it would do every 3 weeks, and then every month. Until I was 8 months old, they did the tumor removal, the chemo. I mean, I was a baby, so I feel like because it was wrapped around my spinal cord, I'm paralyzed. I always say that mom mainly dealt with the cancer part. I was an infant, even as a child. It wasn't something I was in control of. I didn't have to make any decisions or had any feelings, because it was always something that just was in my life. It wasn't before or after. And so she dealt with the cancer part. I dealt with growing up being in a wheelchair. I mean, obviously with me, because of the wheelchair, I'm kind of obvious that something happened, not necessarily cancer, but most people that I've known through different fundraiser, different organization type things as I'm growing up, I mean, you could look at somebody, especially on campus like this, and you would never know unless they told you, or unless something happened to them and they happened to bring it up. And I guess the biggest thing is don't be afraid to ask questions if you know that person, because generally they would rather you know the correct story than just wondering. Originally a doctor, because I spent most of childhood being around doctors, and then I don't like needles at all, whether it's on me or anyone else, so that quickly wasn't going to work out. So I thought about doing research, and then in school I really liked that, so eventually majored in accounting. So obviously the ones now are flawed, but when you're diagnosed, or when your child is diagnosed at that age, it's kind of like, we know this isn't perfect and it might cause issues later, but it's either do this now or they die. But obviously when you grow up and you're like, well, I have all these other problems, it needs to be better, so you don't kind of have to make that rock and a hard place choice. Important because the only thing that you really see on TV, and I probably have mentioned St. Jude a lot because I was a patient of theirs, but if you ask somebody, what do you know about childhood cancer, probably the only answer you'll get is St. Jude, maybe a children's hospital, but there's not one. Versus, let's say, breast cancer, you could probably name 10 organizations, popular ones that people could name. And so just more people trying to dedicate to the subset of just pediatric. Not that all of them aren't important, because I mean obviously they are, but more of something that's underfunded, underutilized. Obviously, because if it wasn't for whoever fought before me, I wouldn't be alive. And because you shouldn't know anybody, or there should never be a story, whether you know somebody personally or you see it on the news or whatever it is, with children there's so much potential in a child, and you don't know what that child would do later. So there should never be a child, especially when they're the most vulnerable, that have any that pass away for something because of not enough funding or not enough research or something that can be fixed. I mean, there might not ever be a cure, but until more research and funding and whatnot is put more towards it, there's not going to be one. Please join the fight for fun.